to get a refresher on proper techniques to everyday tasks. That includes brushing your teeth. This morning we're joined by the Texas Tooth Lady. I'm talking about Dr. Terri Alani with the very best practices. Welcome. Thank you for being here.
Thank you for having me.
Well, we have a little example here. Nice to see you. We'll get to this in a moment. But let's first of all talk about the fact that there are really wrong ways, no matter what age, that people brush their teeth. Do you see this a lot with your patients and you can tell?
Yes, actually, the worst thing you can do is brush with a hard toothbrush, even a medium toothbrush. You want to brush with a soft brush. And what happens with those patients that brush too aggressively, they can wear the enamel down, which can cause extreme hot and cold sensitivity with their teeth. And also it can cause toothbrush abrasion, where patients will come in and they'll have roots exposed, because what happens is it pulls the gum tissue away from the tooth, and then the tooth can become vulnerable to gum disease and cavities. So it's not really how often you brush, it's how you brush.
So people think that they're doing their mouth a really big favor, scrub-a-dubbin, but slow the roll a little bit, you're saying. I also see you brought in some mouthwashes. What do you think about that? It seems like it's a little bit controversial about how people feel.
So the interesting part is when you're looking for a mouthwash, I was at the store, there are so many mouthwashes, it can be very confusing. But when it says that it kills 99% of your bacteria, I would not buy that product because it's killing the good bacteria as well. So you want to maintain a healthy balance between your good and your bad bacteria. You want to stay away from any mouthwash that has alcohol in it. Alcohol will dry your mouth out, and also hydrogen peroxide, because both of those will kill the healthy bacteria as well. So you want to look with for a product that basically does not kill off all your bacteria. So stay away from the alcohol and the hydrogen peroxide. The other thing is the American Dental Association recommends that you brush 2 minutes every time you brush. Now you're going to be surprised at this. When do you brush? That's important. So you want to brush at night before you go to bed, and you would think you would brush your teeth after breakfast, correct? But it's exact opposite. You brush your teeth when you first wake up, and there's a reason. When you eat breakfast, you have acidity in your fruits, in your juices, in your coffee. So if you brush your teeth right after, you're weakening the enamel, and it takes over 30 minutes for that enamel to reharden. So if you're going to brush, you want to wait 30 minutes till after you eat. Even red wine is very acidic. So what I recommend, if you just gotta have clean teeth after you eat, swish with water, and also you can chew sugar-free gum.
Very good to know. Now we're almost out of time. Do you want to just give people an example of this way, what you need to do?
You do not want to do a sawing back and forth motion. It's circular motions, very soft, at an angle, a 45-degree angle. You want to brush for 30 seconds each section. You have 4 sections in your mouth. You want to make sure that if you're going to use the mouth rinse, you're going to use it 30 minutes after you brush, because you don't want to brush the fluoride away. And flossing, you want to floss before you brush.
And you only floss the teeth you want to keep, right?
Exactly.
Isn't that the rule?
Yes.
All right. Thanks for coming in today, Dr. Alani.
Thank you.